Good morning, everyone. I'm Lori Vick on behalf of Summa Health and Akron Children's Hospital. I want to welcome you to this very important webinar on children and COVID-19 vaccine. And we are welcoming our guests. We're streaming live on Facebook, YouTube, LinkedIn, and Vimeo. So welcome to all of you. This is an important topic. We know you may have a lot of questions. So please feel free to write in your questions in the comment box on your platform, and we'll get to just as many of them as we can, possibly in the time we have with you today. Now, as we all know, that the CDC has opened up vaccination for COVID-19 for children ages 12 and over. And so, of course, this does raise a lot of questions, and we brought together an esteemed panel for you today to answer many of the questions that you may have. And so joining us, and I'll ask each doctor to raise their hand so we know which one we're referring to, is Dr. Thomas File, who is chair of Summa Health Infectious Diseases. Welcome, Dr. File. And Dr. Shanu Agarwal, who is chair of Summa Health Infection Control. Welcome, Dr. Agarwal. And from Akron Children's Hospital, we certainly want to welcome Dr. Eric Robinette, who is pediatric infectious disease physician, EPIC medical director, and a physician informaticist. Welcome to all of you. I'd like to start off before we get to our viewer questions with a question to launch our discussion for each of you, designed for each of you panelists. So first, Dr. File, if you could start us off and launch our discussion. If you can start, share us some of the facts about the trials for this age group.
Well, thanks, Lori. But let me first of all start saying that we're very fortunate to have available safe and very effective vaccines. And quite honestly, this is the way we're going to be able to end the pandemic, but we need more to be vaccinated. So I think the recent authorization of the vaccines to those aged 12 to 15 is a very good news and very welcome development. But briefly regarding the recent clinical trial for that age group, this is actually an extension of the same protocol of the Pfizer vaccine candidate that was used for those 16 and over. It's the same dose, required 2 doses. For this particular group of participants, there was over 2,000 participants enrolled, half received the vaccine and half a placebo. And the results were extremely positive. I mean, 100% effective against preventing symptomatic infection. The side effects were similar to those in the older age group, particularly 16 to 25. And there were no serious adverse events related specifically to the vaccine. And another effect was that there was a higher immune response in this age group. And I think that bodes well for the protection as well as probably the durability of the vaccine. So all in all, very good news.
Wonderful, and thank you for that. And Dr. Robinette, we know that children did in fact and do in fact catch COVID-19. So there was a lot of controversy about that perhaps children are naturally immune or don't get it as frequently. And what do you see in the hospital? What is the experience of children who actually do get COVID-19?
So that's a great question, Lori. I think it's important to, think through all the pieces of the pediatric experience with COVID-19, right? So certainly we understand that children are less likely to be hospitalized and less likely to die from COVID-19 than adults. But remember, that's a relative comparison to a disease that's causing tremendous problems among adults. And in fact, it causes significant problems in children too. So they estimate that there was 1.5 million confirmed COVID cases in adolescents over the course of the pandemic. They estimate that when you account for the cases that we don't detect, there may have been as many as 22 million pediatric cases so far. We do see hospitalization. So the cumulative hospitalization rate for the COVID-19 pandemic in adolescents has been greater than for the H1N1 flu pandemic. So even though we're not seeing huge numbers of hospitalizations at once in adolescents like we've seen in adults, we are seeing hospitalizations, particularly in children with underlying health risk factors like obesity, asthma, developmental delay, things like that. There's been 127 deaths from COVID-19 among adolescents. And there's a very serious complication late after COVID-19, 4 to 6 weeks, called system inflammatory syndrome that's more common in children than adults. There's been 3,800 cases of that. It's estimated anywhere between 1 in 1,000 and 1 in 10,000 children who have COVID-19 may develop that complication. And many of those patients are in the ICU. Essentially, all of them are hospitalized, sometimes for lengthy periods. And though fortunately it does tend to respond pretty well to the treatments that we have, it's a very serious illness. So there can be serious complications of COVID-19 in teenagers. And then I'll just add finally that teenagers clearly can spread COVID-19. They can get asymptomatic or mildly symptomatic disease, and they can spread it to others. And so they are a major driver of the spread of COVID in the community, which is really what we need to stop in order to end the pandemic, as Dr. File said.
Wonderful. So it really is reinforcement that this is a reality in all age groups. So thank you for that. And Dr. Agarwal, why is it important for this age group, the 12 to 15 age group, which has now recently been permitted to get the vaccine, for them to get the vaccine in order for us to reach what we call herd immunity?
Yeah, sure. Thank you, Lori. So, as of now, we've offered the vaccine to probably about 87% of the US population, if you look at the age groups that the vaccine has been offered to. When we open it up here to the 12 to 15-year-olds or the adolescent age, we've opened it up to about 17 million children. And this is important because we need to reach herd immunity. And what is herd immunity? What we're trying to do with herd immunity is really get a majority of the population, which we think it's anywhere between 70 to 90% of the population immunized against this disease so that we can protect those who are most vulnerable or who are unable to get the vaccine. So that is why once we include these adolescents in this group, we're getting closer to our goal of reaching that 70% to 90%. And again, we don't know what that magic percentage is yet, but it's probably somewhere in between there. And if you look at the COVID cases within the United States, 1 out of 5 have been in age groups of less than 18 years of age. So 1 out of 5 cases of COVID. And just as adults want to eventually get to normalcy with the potential to gather and socialize, that is true also for adolescents. So this is one step closer to meeting that goal.
Great, thank you for that. Now, we are getting some questions coming in, and a couple of them I'd like to combine, if I may. Doctors, there are 2 questions. One is, what are the long-term effects for children? I suppose that's possible side effects for children, including fertility complications. And the other question is, rumors of sterility where have the rumors of sterility come from? And so I'd like to perhaps combine those 2 questions. They seem to relate to each other. And whomever feels they would like to respond to that, please feel free to.
Well, I guess I'll start out. There are a couple of things. First of all, as far as the long-term effects, obviously the vaccine has only been used now for about 6 months, so we don't know longer-term effects than that. But let me just reassure our viewers that if you look at all the other vaccines that have been approved and look at their clinical trial data, virtually 95% of all even long-term possible effects have been identified within the first 2 months. And so that's why, the FDA was very strict on being able to observe the participants of clinical trials for that period of time before they actually provided the authorization. So I think that's really important to be aware of. And so, but obviously the FDA, the CDC, through all of their surveillance studies are going to be evaluating any potential effects that come down the line. But personally, I really think these vaccines are very safe, and certainly the benefit far outweighs any potential adverse effects that we might have now. Now, as far as the issue of infertility, unfortunately, that has been propagated in social media. I mean, there's a sort of a campaign to suggest that antibodies that are produced by the vaccine, which I'm sure most of our viewers are aware, is specifically against what we call the spike protein, which is that projection from the surface of the virus that attaches to our cells. That neutralizes that and does not allow the virus to therefore attach to the cells and therefore cannot infect the cells. Now, that's very good and it's very effective, as we've already said. But there's this false information that that antibody can sort of cross-react with some hormone that's involved in fertility. I can't remember exactly what it is, but that's not true. That does not happen. And then if you look at women who have had natural infection with COVID-19 and therefore develop all of those antibodies, not only the spike protein, I'm not aware of any increased problem with infertility in those patients. Then I also say that both the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine both support this vaccine.
And I could add to that too. So yeah, there's no plausible scientific reason to think that the vaccine would do that, number one. And number two, there's no evidence yet to show that it would do that. Now, we want to be honest about what we believe to be true and what we know. And Dr. Feil, I think, spoke eloquently about the follow-up duration that we have, and that's clear. I also want to point out that we have a history of having navigated this problem before with vaccines. So when we were trying to develop a vaccine for mumps, the mumps virus does cause problems with fertility, and we understand how the mumps virus does that. And we were able to develop a mumps vaccine that does not do that, right? And so, so this is not a problem that we haven't navigated before. And typically, if the vaccine would cause it, the disease would also cause it, and the disease would cause it at a higher rate than the vaccine. So, it's when you are comparing the risk of the disease to the vaccine, even when you factor in small levels of unknowns, the disease almost always comes out as the more dangerous option.
And Dr. Robin, while we have you responding, there is a question here. My child has a history of febrile seizures. What impact might that have on her vaccination?
Well, so the vaccine causes fever in a small percentage of patients. About 8% of patients that get the vaccine experience a fever, and it seemed to be about the same in 12 to 15-year-olds. So, everybody's a little bit different, but some patients with febrile seizures can have a febrile seizure triggered by vaccines. We've experienced that with specific vaccines that we give in young children that have higher rates of febrile seizures, but generally, it's not a contraindication of the vaccine. It's definitely not a contraindication of the COVID vaccine. It's something that we manage medically. So I would encourage you to talk with your pediatrician and think through how to approach that in a thoughtful way. But it's definitely not a reason not to get the vaccine.
All righty. And a follow-up to that is my child has a history of allergies. Will this impact the vaccine?
Sure. So generally speaking, no. There's a few specific exceptions. So there's a pretty low rate of allergic reaction, the serious allergic reactions to the mRNA vaccines, the Pfizer type vaccine. It's about 1 in 100,000, so quite rare. All of the vaccine sites are required to be equipped to manage it. And in the one case that we've had of that in our program, we've successfully managed it and the patient was fine. If the child has a specific allergy to the COVID-19 vaccine, which you wouldn't know, that would be a reason not to get, say, a second dose. And if you have a history of serious allergic reactions like anaphylaxis to other vaccines, we take some extra precautions, but it's still not a reason not to get the vaccine. And not just the vaccine safety data that I presented, but also just anecdotally, we've vaccinated dozens and dozens of people with serious allergies to various things safely. And so those are not reasons not to get the vaccine, but we take some extra precautions.
Okay. And just to clarify, that child had a bad or negative reaction to the flu vaccine. So the parent is wondering, would that have a similar impact here?
We would take those extra precautions, but there's no ingredients that are the same between the flu vaccine and the COVID vaccine. And so typically your allergies are to a particular ingredient. So there's not really any strong reason to think that those would cross-react.
Okay. And Dr. Agarwal, perhaps you might want to address this question. I have the vaccine, so do my kids really need it?
So, yeah, thanks. if you've had the vaccine, correct, you may not be transmitting the virus to your children. However, if your children are going out and they're exposed to anybody else, any other children that, let's say, may have asymptomatic disease, they are potentially can contract the disease from somebody else. And your child may be asymptomatic and not have any symptoms at all. But again, they may be still transmitting it to somebody who might be more vulnerable. So even though you've had the vaccine, assuming your child is around other folks or, in some sort of classroom setting or with other children, they're still at risk to get COVID from somebody else.
Yeah, and
And so now, go
But if
ahead.
I may add, Lori, now we're getting into nice weather. It's beautiful now here, at least in Akron, Ohio, today, and we're looking forward to the summer and nice weather and being outside. And now the children want to go to camp. They want to go and play with their friends. They're going to be in sporting events or whatever. It's going to be much safer for them to do that. And like Shanu said, without risk of transmitting to others or picking it up from others, the more of their classmates or their friends or their playmates are immunized.
And Dr. File, there are children who have had COVID, and so a parent has written in, my kids have had COVID, why should they get the vaccine?
Well, that's a good question. We do know if you've had natural infection, you will have a degree of immunity. But, interestingly with this, and I'll be interested what Eric says, I mean, usually when you've had natural infection, you have better immunity than from a vaccine. This is the opposite. I mean, the vaccine engenders a much greater, of course, there's 2 doses, at least with the Pfizer vaccine, but it engenders a much higher antibody level and probably a T-cell antibody response as well. That gives a very good response that is going to protect the child and also probably increase the durability. But there's also other reasons. I mean, I honestly don't know about the situation in adolescents, but I'll tell you, in young adults, we're seeing a lot of people who never even knew they had COVID because it was asymptomatic, but yet months down the line, it's not the multiple system inflammatory syndrome that Eric was talking about, but we're seeing these long-term persisting lingering symptoms, mainly fatigue or arthralgias, joint aches, just not feeling well, could be loss of taste and loss of smell that occur down the line after they've had COVID-19. So that can be prevented if you prevent the infection. So there's a lot of reasons why this child who prior had COVID, we want to get them vaccinated so that they'll have a longer duration of immunity and prevent subsequent infection down the line.
The other thing I just wanted to add, sorry, to that is, with natural infection, you have some immunity, but I think we still don't know, and correct me if I'm wrong, Dr. Robin or Dr. File, with all the variants, if you've had a COVID infection, we just don't know how well you're protected against the variants as well. So don't forget with all the variants that are circulating.
And that's a great point. So Dr. Files, I totally agree. The antibody titers are much higher from vaccination in teenagers than they are from natural infection. And one of the things that's interesting about most of the variants is they appear to reduce for certain variants that do have an impact on vaccine effectiveness, reduce but don't eliminate the effectiveness of the vaccine. And that the extent to which that happens depends a lot on your antibody levels. So it's possible that having had natural COVID infection might protect you against a COVID infection again with that same variant for an extended period of time, but that higher level of titers that you get from the vaccine may very well protect you better against one of the variants that has a little bit of ability to reduce the effectiveness of the immunity and of the immune response. So that's another piece of that. I'll also just add that they very carefully studied this vaccine for safety in people who had previously had COVID-19. That was a concern: is could it cause more safety issues if you had COVID-19 in the past? And we now understand very clearly that the vaccine is completely safe in people that have previously had COVID-19, just as safe as if you've not previously had COVID-19. There's no safety concern at all if you've had COVID.
Yeah, and if I also may add to that, I mean, if you look at the clinical trial, interestingly, there were 2 recipients who developed COVID-19 who actually, when they went back and looked at their seroconversion prior to the enrollment into the trial, actually had COVID previously. So, and that only occurred in patients who had received the placebo, so that there was no evidence of a recurrent infection in patients who received the vaccine in the clinical trial. So that's, again, another reason to get that vaccine. And as Eric said, the patients who did have COVID prior to the vaccine did quite well and did not have significant adverse events in addition.
Great discussion, all. And while we were discussing, we had a question coming in from a parent who says, my children are under the age of 6. Are there any advancements, or what's the future for children under the age of 6 and the vaccine?
So there are clinical trials for several of the vaccine candidates that are still enrolling patients. I think there's one site in Cleveland that is enrolling children in the 6-month to 11-year age group for one of the vaccines. If you're interested in looking for that, you can look on clinicaltrials.gov to see what's close to you. What I've seen so far is anticipate that those studies will start to have sufficient results to make a decision about vaccinating 6 months to 11 years, probably sometime in the fall. Not clear exactly when in the fall, and there's still some mileage to go on that work. The reason that it's taking a little longer for that age group is because, we know that children are not little adults. But 12 to 15-year-olds are a lot closer to a 16-year-old and a lot closer to a 25-year-old than a 6-month-old is. And so what this trial for the 12 to 15s was an extension of the adult trial, where we're just sort of working our way down the age groups. And in the younger patients, they really want to test different doses and make sure that they have the right dose. The 12 to 15s get the same dose as adults, and it's safe. But they want to test different doses in the younger age groups to make sure it's correct. And so that takes a little longer. So I think probably that's why we're looking more like the fall.
And this is a follow-up question to that, actually, and this is from Jade, who asks, Dr. Baum might have answered a little bit of this at the beginning, but how were the trials done in children, and did parents feel comfortable letting their young children participate in these trials? And of course, that question would certainly relate to the even younger set we just addressed. Dr. File, would you like to start us out on that?
Well, again, obviously there would be a parental consent involved, but that did occur with all the patients that were enrolled in the trial. I mean, I'm aware of surveys that have looked at parents of children between the ages of 12 and 15. Somewhere between 50 and 60% feel very comfortable allowing their children, and hopefully that will increase as we have a greater population within this group being immunized to show how beneficial it is. But I can't stress more that, we need as many, and Shanu mentioned this, I mean, to get to the point where we have herd immunity, where you stop transmission, because that's the real purpose of getting to a large population and therefore getting herd immunity, that you stop transmission of this virus. Because still in Ohio, we still have active transmission, and we need to get more people immunized. And so, parents of these children need to carefully look at the information that Eric provided, that Shanu provided. This is a very safe, extremely effective. We need to take benefit of this, the tremendous effect of this vaccine. So I'm hoping that people that are viewing this will take the advantage of this opportunity.
All right, thank you for that. And now we have a question from a parent who said, if I have my child vaccinated now, how will that impact the vaccines that will be required for school in the fall? And I think the idea here is, does a significant period of time have to lapse in between?
I can answer that question, Lori. The short answer is not at all. You can still get all of your other preschool vaccinations. And so both in terms of getting yourself protected and also getting your child protected, as well as helping us reduce transmission in the pandemic, there's no time like the present. There's really no reason to delay vaccination. I will address that. Previously, there was the CDC had struck kind of a cautious note about administering other vaccines at the same time as the COVID vaccine, or within a 2-week window of the COVID vaccine. And that's because there's a tiny handful of vaccines that can interfere with each other. effectiveness. So it's not a safety concern so much as an effectiveness concern. And they recently removed that requirement for a couple of reasons. So one is that type of interaction is rare, number one. Number two, we haven't seen any evidence of that type of interaction so far in our post-marketing. And the third thing is that we are seeing that children are falling behind on their vaccinations, right? On their pertussis vaccinations, on their meningitis vaccinations. And so we want to vaccinate them against COVID very much. And we also don't want that to have a negative impact on our ability to protect them against all of the other illnesses that we use vaccines to protect them against. So for that reason, we're administering, you can receive any vaccines at the same time or very close to a COVID vaccine, and we have minimal concerns about that.
Wonderful, thank you. And this is an interesting question from a parent. How many children have not gone through the vaccine process safely? And I think what they mean by that is, in the trial, have there been adverse effects for children, and how many children did have adverse effects, if any?
Again, if you look at the trial of the data that's available, there were no significant what we call serious adverse events. I mean, that which required hospitalization, et cetera, that were attributed to the vaccine. But, I'll have to acknowledge, I mean, the number of recipients who received the vaccine in that age group was somewhere around 11 or 1,200. And I think Eric mentioned this as well, but, the side effects that we see in older age groups are very similar. I mean, 8 to 10% will have fever, particularly after the second dose, but it's going to be transient. It's going to last 1 to 2 days and it's going to go away. A lot of them will have a little bit of muscle aches or fatigue or headache. I mean, this is very common with all of the recipients of the vaccine, no matter what the age is, actually. And they are transient. And so I guess if people are concerned about that, they could, particularly about missing school or whatever, you could have it on a Friday or whatever. But these are just manifestations of your immune system working. So when patients complain about that to me, I say, well, look, you've got a good immune system because you're reacting in that way. These symptoms can be ameliorated. I mean, you can give Tylenol, you can give ibuprofen if the symptoms occur. We do not recommend, however, that you predose the vaccines with those medicines, because there is some information or evidence that you might reduce your antibody response level, and we don't want that. And quite honestly, these adverse events, or I should say side effects, don't usually occur to, at least in older 16 and above. I really don't know the timing of the 12 to 15, but they usually don't occur to about 8 to 10 hours after receiving the dose. And so taking Tylenol or ibuprofen before the dose probably is not going to be of much use, because of the duration of the timing of the effect of those medicines are going to be relatively short, 4 to 6 hours. But it's okay to take those medicines after you may experience those side effects, because you can ameliorate them, and they will be much better tolerated, and they're going to go away in 2 to 3 days anyway.
Yeah, and I'd just like to add to that, just on a personal note, my 12-year-old had his vaccine last week, and aside from a little bit of fatigue, he was fine. There was actually not a lot of pain at the injection site either. And I just feel this age group's very resilient. So even if it's something mild, they just sort of look it over. And within 24 hours, he was sort of back to his normal self. So just wanted to give a personal experience on that.
And how great that you shared that.
One more little fact there, which was that the withdrawal rate in the trial from dose 1 to dose 2, meaning people that got dose 1 and then because of a side effect that they experienced decided not to get dose 2 among those pediatric patients, was 0.2%. That means 2 out of 1,000 had enough side effects that they decided not to get the second dose. That's really, really low. So children tolerate this vaccine well.
And I just wanted to comment on Dr. Agarwal having her own children receive the vaccine. It's so important. And Suma Health held a fabulous event last Sunday where physicians brought their children to be vaccinated, which is truly a testament to, this is science, and these are medical professionals who are believing this and setting the example for the community. So thank you for leading the way, Dr. Agarwal, as an example to the rest of our community.
Absolutely.
We do have a question regarding a booster shot. Is this going to be necessary for children? And of course, then that begs the question for all of us as well.
I'll start, but it's going to depend upon information that is occurring right now as far as the duration of effect of the vaccine in various age groups, as well as various persons who have underlying conditions. Right now, we know that at least in the persons 16 and over, 6 months, after 6 months, there's still good, robust immune response. And so, if we have to have it in a year or now, or sooner, we don't know that yet, but information is accruing that will be able to answer that. It's anticipated we might need a booster in the future. I would think maybe within a year would be reasonable. It's going to depend upon what happens to the virus over this period of time. Personally, I do believe that the virus will stay with us. It'll probably become a seasonal type of a viral infection causing respiratory infections. We'll just have to see what happens in the future, but we will know, and we will have available if we need boosters in the future.
All right, wonderful. Now we have a
One
question
more comment
here.
there, Lori.
Oh, yes, please, go ahead, Eric.
Yeah, I think the other piece just to say is that the other thing that may factor into whether and how soon we need a booster is whether and what variants are circulating. And the fastest way that we can stop the variants from circulating is to stop the virus from circulating, and that's to get everybody vaccinated now. So we can help ourselves a little bit by getting the vaccinations going.
Yeah,
It's
I'd
kind
like
of a cycle that we're trying to break.
Right.
Go ahead,
I'd like
Dr.
to add to what Dr. Robinette said. I think that a lot of it is a race between how fast we can get vaccinated and these variants. So we really need to be on top of the vaccinations and get as many people vaccinated as possible to prevent there from being more and more variants.
Wonderful. And here we have a question, and this is a timely one, with mask mandates being lifted, and we know here in Ohio, June 2nd, the protocols will be gone. I know my neighbor next door, who's 12 years old, told me last night, oh, I hope the last few days of school we don't have to wear masks. So a lot of people are looking forward to this mask mandate being lifted. But as they are lifted, do you have advice for children who are too young to get the vaccine at this point?
You know, I would like to say, so as I mentioned, I have a 12-year-old that got vaccinated. I also have a 10-year-old and 7. I should know my ages of my kids. Sorry. A 10-year-old and a 7-year-old who are not vaccinated. And I believe that it is very important for them to continue to wear a mask and follow all the mitigation protocols until they are vaccinated and until we are closer to that herd immunity or get more folks vaccinated. And with this mask mandate being lifted, I think that really it's on everybody to follow those protocols and to be, I think, smart about it, depending on your vaccination status and your underlying health conditions. So in my opinion, I think it's still important if you have not been vaccinated to continue those the masks, the social distancing, and the hand hygiene.
Mm-hmm. All right. And then we have a parent writing in that my daughter does not turn 12 until August. So here we are with the great summer approaching, and perhaps many of her friends are vaccinated. What course of action should this parent take? Is there any way that she can get it early, for example?
Lori, I can answer that. Unfortunately, we really have to follow the CDC's emergency use authorization, and that follows the science, and you have to draw a cutoff somewhere. And so where we draw the cutoff is 12 years old. So I don't think that we would give it early, but I promise we'll still be vaccinating in August.
Okay. A question here is from Faith, who wants to know, what about blood clots from the vaccine? I think we hear about instances of that upon occasion in adults. Would this still be the same in children?
Well, I'm not aware that this has occurred in any of the studies with children. I'm sure that our viewers are aware that for a certain period of time, at least with not this vaccine, not the Pfizer vaccine, but with the J&J vaccine and then AstraZeneca vaccine, which are different technologies actually for developing the vaccine. But there was a pause in the use of the J&J vaccine in this country earlier last month because of concern of these brain clots or the cerebral venous sinus thrombosis in 6 women out of about 7 or 8 million doses that have been administered at the time. The CDC evaluated this, or excuse me, the FDA evaluated this. They found several more, up to about 15, I think, but they eventually concluded that it was much safer to have the vaccine than to have the COVID, because there was a study out of England that showed that the incidence of this very same type of brain clot, which can be serious, was much higher in patients who actually developed COVID itself rather than the vaccine. So getting the vaccine, you prevented that, or at least you reduced that significantly compared to if you had COVID. So based on the assessment, the FDA later last month approved or at least authorized the J&J vaccine, and it is still considered much safer, or let's put it this way: the benefits even of the J&J vaccine. But remember, the J&J vaccine is not what we're talking about when we're talking about the adolescent group. So the J&J vaccine, the benefit still far outweighs the potential very rare complications such as this blood clot issue.
And thank you, Dr. Farrell. This is the Pfizer vaccine that has been approved for this age group. And we have a question which is perhaps a follow-up or an extension to questions that we have already addressed, but it is, how long do we know how long the protection lasts? Because these are clinical trials which have happened so recently.
Well, I mentioned earlier that, the mRNA, both Pfizer and Moderna, looked at their evaluation after 6 months in their clinical trial, and there's still a very robust antibody levels that were present in this. I think as we're starting to have information concerning breakthrough infections or breakthrough disease after being fully immunized, we're going to find out exactly what the level of immunity is going to be required to be protective. So we'll know what the duration is going to be as more information is developed.
Wonderful. And this question comes in for Dr. Robinette. Do masks make it harder for kids to breathe? I noticed that in my child. I think, Dr. Robinette, you might need to unmute.
There we go. We've been asking children above a certain age to mask in our hospital since the beginning of the pandemic when they come for their appointments and things, and we haven't seen that to be a huge problem. I mean, I think we've all experienced what it feels like to wear a mask. The types of masks that we're wearing don't usually, the typical ear loop procedure masks don't usually impede the airflow significantly. But it's not the most comfortable thing in the world, and some kids may be a little bit sensitive to that. So I think it's important to be sensitive and patient with our kids and explain to them why we're doing it. But physiologically, there's no reason that it should affect their ability to breathe or their lung health or anything like that.
All right, thank you. And then for parents who are interested in pursuing this, how can they go about getting a vaccine for their child? Dr. Agarwal?
So Akron Children's is offering the vaccine, and it's a wonderful process. It's actually very well, very systematic in the way they have the process. So I think you can schedule it through your My Chart, or actually if you just go to akronchildrens.org, you should be able to schedule an appointment online. And SUMA is also, we've got mass vaccination clinics on the weekends. And if you have a My Chart, you can schedule through there or call 234-867-7110 and schedule through the phone line. So those are two ways to schedule. And I think a lot of the local pharmacies, if you check with them, they are also offering the vaccine. It's very, very easy. A lot of them have walk-ins. You just have to make sure that they're offering the Pfizer vaccine. And once you put in all your information, you'll be able to tell whether your child is eligible to get it at that pharmacy.
We are wrapping up our time now. Is there any final word that any of you doctors would like to have for the public and the community, parents and grandparents who are listening and viewing with us today regarding their children and the vaccine?
Well, Lori, I would just say that, and I think all three of us have said this, that is extremely important for all of us who are eligible to receive the vaccine to do that, because that's how we're going to end this pandemic. We need a higher percentage than we have right now. There's still a transmission within the community. And if we want to end the pandemic, we want to get back to normal, everybody should get the vaccine.
Yeah. And I do have a few words I just wanted to say. I know one of the early questions was the side effects from the vaccine, including fertility, sterility. Um, I think it's important to realize what COVID can do itself as a disease. I do practice adult medicine, but I've seen a lot of young adults who had COVID disease, but had the long-term effects, which were long-term lung effects. Or what I find concerning too is the brain fog that you hear about, where they have some issues with cognition, memory. And with adolescents, with children who are really in the peak of their time where their brains are sponges and they're learning so much, it's just concerning to me that if they were to have these COVID long-term effects, how that can affect them as far as, socially and with their education. And so that's just something to keep in mind, more coming not from a physician, but a physician parent, who has young children.
Mm-hmm. Wonderful.
Um,
Well, we thank you. Yes, go ahead, Dr.
I guess my comment would be, vaccines are the most powerful tool that humanity has ever invented for fighting infections. If I had to give up every other tool that I have and keep only one, the one that I would keep would be vaccines. And additionally, we have exceedingly high safety standards for vaccines, and we should, because we're giving them to people that aren't sick yet. And this vaccine was not hurried. It wasn't rushed. It was brought forward very quickly by intentional effort, and it meets the safety standards that we have for vaccines. And it's a vaccine that is safe and really effective. So I second Dr. File. Everybody should get it.
Well, thank you so much, all of you, for your sage advice. And we know that when summer comes, parents are always concerned about safety issues, and typically they are about running around on the playground and being safe. And this year, there's an extra special safety precaution that we have as a tool in our toolbox to keep our children safe. And we do encourage all parents to take advantage of that and make it a safe summer and a safe life for their children moving forward. We want to thank all of our viewers who have tuned in today. If you still have questions that perhaps were not answered, feel free to write them in, and our panelists will get back to you with those responses. So thank you again, Drs. File and Agarwal from Summa Health, and thank you to Dr. Robinette and Akron Children's for partnering with us on this important topic. Again, we mentioned about scheduling for a vaccine, so if you would like to, at Summa Health on your My Chart, schedule the vaccine for your children or for yourself, or call this number, which is 234-867-7110. And for Akron Children's, visit akronchildrens.org. And anyone who would like may watch this Facebook Live again. Perhaps you tuned in a little bit late and there was some fabulous and very important information for children and the vaccine by our panel. Go to summahealth.org/coronavirus. Thank you all so much for being with us today. Have a wonderful rest of the day and enjoy a very safe